Hi, this is day 7 of my walk for Heart Month, where I'm walking 50 miles over the month of May to raise money for the British Heart Foundation so they can continue their vital research into cardiac conditions. Today I was joined by Coach Adam Wilson, who I'd like to say a massive thank you to, as he always supports me not only in the gym but also outside of it. The link for my YouTube account is now on the bio, on the Instagram next to the Just Giving link. Instagram don't allow videos over a minute long, something we only realised yesterday, so I've not been able to watch the full stories that we've filmed in full. Today I'll be speaking about the heart condition, Takotsubo syndrome. Takotsubo syndrome is a word taken from the name of a pot used in Japan to catch octopuses. With Takotsubo syndrome, the left ventricle heart chamber narrows towards the top, looking larger and rounder at the bottom, like a Takotsubo pot. Takotsubo syndrome causes your heart's main pumping chamber, the left ventricle, to change shape and get larger. The heart muscle becomes weaker and its pumping action loses strength. Takotsubo syndrome is also called broken heart syndrome, Takotsubo cardiomyopathy, acute stress-induced cardiomyopathy, apical ballooning syndrome, and Takotsubo. The condition is usually temporary and happens to some people when their body is coping with overwhelming physical or emotional stress. Many know it as broken heart syndrome because of its connection to grief. The condition can last a few days or weeks. With medicine, most people commonly recover. Unlike some other cardiomyopathies, like hypertrophic cardiomyopathy, it's not an inherited heart condition. The people who are most at risk of it are women and people over 50, people with mental health conditions like anxiety or depression. The symptoms of it are sudden intense chest pain, pressure or heaviness on the chest, and shortness of breath, and also a heart attack. It can feel like a mini heart attack. Other less common symptoms are palpitations, feeling faint or lightheaded, and feeling or being sick. What exactly causes it? No one knows the cause of Takotsubo syndrome. Experts suggest that a rush of overwhelming stress hormones like cortisol and adrenaline put sudden stress on the heart, causing temporary damage. For some people, an event like death, illness, surgery, mental trauma or financial stress can trigger Takotsubo. Our researchers are still trying to understand the reason for this. Takotsubo syndrome is diagnosed after you come to hospital with a heart attack symptoms. You'll be sent for tests to see what the problem with your heart is. These may include blood test, a coronary angiogram, an ECG, an echocardiogram, or an MRI scan. You will be diagnosed with it if the test rule a heart attack, your heart muscle looks weakened or is not pumping blood as it should, or your left ventricle has X shape. Your doctor will also ask if you have about your medical history and if you put under any physical or emotional stress recently. Takotsubo syndrome is treated by using diuretics, beta blockers, and ACE inhibitors or ARBs, or blood thinning medicine if you're at high risk of developing blood clot or an arrhythmia such as arterial fibrillation. People usually recover from Takotsubo syndrome by staying in hospital for a few weeks until they begin to fully recover. After you've been diagnosed, you'll attend checkups with a cardiologist where you can ask them about medicines and your plan for recovery. During this time, you'll be sent for echocardiograms to check how your heart working. You can also try to get active, eat healthily, and talk to others. As Takotsubo syndrome is usually caused by stress or trauma, you may find it helpful to talk to a counsellor or clinical physiologist during and after your recovery. If you're registered with a GP, you can access talking therapy through the NHS. There is no cure for it at the moment, but to prevent another episode of it, many healthcare professionals recommend long-term beta blockers. Thank you again for all your support. Go over and check out the YouTube for the full videos if you're interested, and please keep sharing and donating to the Just Giving, and we'll see you for tomorrow for day 8.